Hello, everybody. Welcome to the fun session, even though we had a lot of fun with Shauna this morning and Mel this morning, but we're gonna bring the fun back because I know it's the afternoon lull. Welcome to the Student Perfusion Bowl for this year. This year, the Perfusion Bowl is again run by the AMSEC Student Council, so it's been a lot of hard work for these students, and they're super excited. Last year, the Perfusion Bowl happened with only 3 teams. This year, it's 4, so it's growing. We've got Daniel in the back. Daniel's going to be running the PowerPoint. Zach Gorman is up here in the front helping us out. John Zavaro's in the front, and I'm welcoming our host, Shelby Stoner. She's a second-year MUSC student, and she'll be running the Perfusion Bowl.
Thank you, Susanna, for the introduction. First, I just want to say thank you all so much for being here, and I just want to thank AMSEC for having me here as well. I'm really excited to have the opportunity to showcase these wonderful students from around the country, and so they can showcase their didactic knowledge to you guys and, show all the hard work that they've put into their perfusion program so far. This year we had a total of 5 teams participate in the bowl, including teams from the Medical University of South Carolina, Lawrence Tech University, Quinnipiac University, and 2 teams from Rush University. Prior to our finals tonight, we held a virtual semifinals round between our 2 Rush teams via Zoom to determine who would be representing the program here on the big stage today. I would like to congratulate Sarah Kulesa and Carmen Matagulai, who joined us here today and were successful in the semifinals round. But I also want to recognize Austin Rasicot and his teammate Luke Jurasek for an amazing effort during the semifinals and for being here today to support Team Rush. So I want to take the time now to introduce our participants in this year's Perfusion Bowl. From Team MUSC, we have Jordan Andrews and Ian Villavicencio. Just in case you guys didn't know where MUSC was sitting. From Team LTU, we have Jonathan Wolf and Thomas Deeb. From Team Quinnipiac, we have Brielle Boutot and Nicole Elvelzio. And again, from Team Rush, we have Sarah Kulesa and Carmen Matagulai. So, of course, I'd just like to take some time to thank all of the people on the screen here, from the individuals in the Student Council Perfusion Bowl Committee, who helped create over 100 brand new questions this year to contribute to our extensive list, or extensive question bank from past Perfusion Bowls, as well as everyone who has been involved with making this session a huge success in the past. I also want to just or make a point of thanking the AMSEC as a whole and the AMSEC Board of Directors for being so supportive of students and welcoming us to the conference each year, having us present, having us be actively involved, especially with the Student Council. And I really want to thank everyone from the bottom of my heart who has made donations to the students throughout this year. Your donations do not go unnoticed, and this is what allows us to be, active and participate in our professional societies early on within our careers, even just as students. And it gives us a way to also come and, be at these conferences here in person. So sincerely, thank you guys for supporting us, and I would like to have a round of applause for everybody who's helped us out. Okay, so for a little bit of the nitty-gritty stuff, basically, this game is just for entertainment purposes only. We're here to have fun. Although our goal is to represent ABCP style questions, I cannot guarantee that these questions will reflect what's on the board exam. We have no affiliation with ABCP. Basically, you still have to study, is what I'm saying. And, just please remember that this is meant to be fun. We take it really seriously as far as maintaining the integrity of the Perfusion Bowl each year. So I would, just like to ask that please refrain from taking photos of the questions, the answers, or the game board, because, this is what maintains the integrity for the bowl for years to come and what makes it so fun. So just a brief introduction of the rules. Only the active team participants can buzz in and answer. The question must be read in its entirety before active team members can buzz in. After the question is read, a timer will begin and teams have 10 seconds to buzz in. Once a team buzzes in, they have 5 seconds to answer the question. If correct, the point value will be added to their overall score. If incorrect, the points will be deducted from the score. If the team who buzzes in first is incorrect, then the following teams will have a chance to steal the question. The team who correctly answers the question then gets to choose the next category and points. And if no team answers correctly, or if nobody answers the question, then the board will be reverted back to whoever had control of it to begin with. So, I don't really know who allowed me to have control of this year, but when I was developing the game board, I kind of wanted to have fun with it. So I made the categories a little bit more exciting. So this year, for our categories, we have My Heart Will Go On, or Anatomy and Physiology. From there, we go into clinical management. What, like it's hard? From there, we go to Go With The Flow, which is ECMO and ECLS. Then we have Perfusion, which is monitoring. From there, we go to Tiny Humans, or Pediatrics. After that, we have Mary Xmas, which is pharmacology, and then my personal favorite, Clot It Like It's Hot, or coagulation. So what do you guys say we get started? It can be more exciting than that. There we go. Okay. So to start off this year's Perfusion Bowl, we have awarded the first pick to the previous champion school, and that happens to be MUSC as the reigning champions from 2023. So MUSC, you officially have control of the board.
Okay, Shelby, we'll go with the flow for 400, please.
Okay, Go With The Flow for 400. We're just building up suspense.
Can you see?
No.
Oh, no, I can't see it, sorry.
Oh, is it not on the TV now?
No. Ah, I got it now. Okay, thank you. Sorry, no, it's just me building suspense for no reason. Okay, carbon dioxide transfer on ECMO support may be increased by which of the following?
MUSC?
D, decreasing sweep flow and increasing FiO2.
I'm sorry, that is incorrect.
Rush?
C, increasing sweep flow and total surface area of the membrane.
Yes, that is correct and good for 400. Let me see, sorry, can I see? Okay, Team Rush, you have control of the board. Oh,
Let's go Clot It Like It's Hot for 500.
okay, coagulation for 500. Okay, you suspect that your patient has developed HIT with a platelet count less than 50,000 post-CPB. Which of the following actions should be taken?
MUSC?
We'll go with C, infuse packed red blood cells, FFP, and platelets.
I'm sorry, that is incorrect.
Rush?
We're gonna go with B, send a plasma sample to check the IgG the antibodies.
Yes, well done, that is correct and good for 500 points. Okay, Rush, you still have control of the board.
Let's go with Perfusion for 500.
Okay, Perfusion for 500. On the atrial pressure waveform, the V wave represents
Quinnipiac?
B. Do you want us to read it?
yes, please.
Okay. Atrial failing during ventricular systole.
Well done, that is in fact correct and good for 500 points. Okay, and Quinnipiac, you now have control of the board. It's like,
Can we do tiny humans for 400?
absolutely. Let's move on to pediatrics for 400. Which of the following are considered cyanotic defects?
Quinnipiac. Go ahead. You're good.
It's D, 1 and 4.
I'm sorry, that is incorrect.
MUSC.
B2, no, A1 and 2.
I'm sorry, you had already answered with B, and that is incorrect.
LTU.
A, 1 and 2.
Yes, that is in fact correct. And good for 400 points.
I didn't get to read.
Okay, LTU, you now have control of the board.
Let's do My Heart Will Go On for 500.
Absolutely, anatomy and physiology. Is that for 500? Yeah, for 500. Autoregulation of glomerular filtration rate during decreased renal arterial pressure involves.
Rush.
Decreased afferent arterial vasoconstriction and efferent arterial vasodilation. B.
I'm sorry, that is incorrect.
LTU.
Go with D, both afferent arterial and efferent arterial vasodilation.
That is also incorrect.
Quinnipiac.
A, afferent arterial vasodilation and efferent arteriolar vasoconstriction.
Very well done, that is correct and good for 500 points.
Quick score update. MUSC at 1,300. Negative 1,300, sorry, didn't see the minus sign. Rush at 400. LTU negative 100. Quinnipiac leading at 600.
Thank you very much, Zach. And I believe Quinnipiac, you have control of the board.
Can we do clinical management, what like it's hard for 300?
Clinical management for 300. All of the following are considered cannulation sites for liver transplantation except.
LTU.
B, axillary vein.
I'm sorry, that is incorrect.
MUSC.
We'll say A, portal vein.
That is also not correct.
Rush.
C, femoral vein?
Also incorrect.
D, hepatic vein.
That is in fact correct and good for 300 points. Okay, Quinnipiac, you have control again.
Let's do clinical management for 400.
Okay, clinical management for 400. Which of the following drugs should not be administered to a pregnant patient on CPB?
Rush.
C. Neosynephrine.
Well done. That is in fact correct for 400. Okay, and it goes back to you, Rush.
Clinical management, 500.
Okay, clinical management for 500. Thrombosis in patients following long-term LVAD placement remains of high concern. Elevation of which lab value may help predict the likelihood of LVAD thrombus formation?
Quinnipiac.
C, CK, and B.
That is incorrect.
LTU.
B, LDH.
That is correct. Well done and good for 500 points.
Ours never turned green, like ever. Ever? Like, not after the first one.
Like, couple ones.
Okay.
It like didn't turn.
So we were like,
Were you pushing it?
No.
They may have just done it for
It's quick.
It just never turned green.
Okay.
Okay,
I'll try.
cool, sick.
Okay, LTU, you have control.
Let's do clot it like it's hot, 400.
Absolutely, coagulation for 400. Protein C and protein S work by inhibiting which of the following?
Quinnipiac.
C?
Yes, that is indeed correct and good for 400 points. Okay, Quinnipiac, you now have control.
Let's do Mary R. Xmas for 300.
Okay, moving on to pharmacology for 300. Is that 300? Okay. Sorry, mine's like delayed. Which of the following can be used to help treat refractory hypotension and combat low systemic vascular resistance post-CPB if conventional treatment is insufficient?
Rush.
C, 3 and 4.
That is indeed correct and good for 300 points. Okay, Rush, you get to choose next.
Can we do pharmacology for 500?
Absolutely, pharmacology for 500. Which of the following neuromuscular blockers may trigger malignant hyperthermia upon administration?
MUSC.
B, 6-acetylcholine.
That is correct and good for 500 points. Okay, MUSC, you now have control.
Can we do ECMO 500, please?
Absolutely, we're gonna do go with the flow for 500. All the following are true regarding veno-arteriovenous VAV ECMO except.
Quinnipiac.
C?
I'm sorry, that is incorrect.
Rush.
B.
Also incorrect.
LTU.
A, it is initiated when traditional veno-arterial ECMO unloading is insufficient.
Yes, well done. That is good for another 500. And the board goes back to LTU.
We'll do clot it like it's hot, 300.
Okay, coagulation for 300. Factor 3 is also known as
LTU.
A, tissue factor.
yes, well done again. That is another 300.
We'll do clot it like it's hot, 200.
Okay, same category for 200. The most immediate response to blood vessel injury is
Quinnipiac. I'm sorry, your time has expired.
okay, time is expired. The question's open.
MUSC.
D, vascular constriction.
That is indeed correct and good for 200 points. Zach, can we get a score update, please?
Yep. MUSC, -900. Rush, 300. LTU, 900. Quinnipiac, 300.
Okay, and MUSC, you have choice of next category.
Can we do pharmacology 400, please?
Okay, pharmacology for 400. Lidocaine belongs to which class of antiarrhythmics?
MUSC.
B, class 1B.
That is indeed correct and good for 400 points. MUSC, you still have control.
Tiny humans 500, please.
Okay, moving on to pediatrics for 500. Which of the following statements is correct regarding palliative pediatric procedures?
MUSC.
B, palliative procedures provide symptomatic relief but do not repair the underlying condition.
Yes, well done, and that is good for another 500. MUSC, you still have the board.
Can we do tiny humans 300, please?
Absolutely, pediatrics for 300. This defect is characterized by downward displacement of the posterior and septal leaflets of the tricuspid valve, as well as an enlarged sail-like anterior leaflet.
LTU.
B, Epstein's anomaly.
Very well done, and good for 300. Okay, board goes to you, LTU.
We'll do tiny humans 200, please.
Okay, same category for 200. All the following are defects associated with tetralogy of Fallot, except
LTU.
C, LV hypertrophy.
that is indeed correct and good for 200. And you still have control, LTU.
We'll finish off the category tiny humans for 100, please.
Okay, finishing off pediatrics. Which of the following is not a type of ventricular septal defect?
Sorry, MUSC.
D, sinus venosus.
Well done, that is correct and good for 100 points. MUSC, you have next choice.
Can we go ECMO 300, please?
Okay, moving on to ECMO for 300. Drawing an arterial blood gas from which of the following monitoring sites may give you the best representation of heart and brain perfusion while on peripheral VA ECMO?
MUSC.
A, right radial.
That is correct for 300 points. MUSC, you have control.
ECMO 200, please.
Okay, ECMO for 200. True or false, arterial filters are used in ventricular assist device circuits?
B, false.
Oh, sorry, MUSC.
B, false.
Yes, that is correct for 200. Okay, and MUSC, you still have control.
We'll finish the category ECMO for 100, please.
Okay, finishing ECMO for 100. All of the following may be indications for VV ECMO except
Rush.
B, unwitnessed cardiac arrest.
well done, that is good for 100 points. And Rush, you have next choice.
Let's do perfusion for 400.
Okay, moving on to monitoring for 400. A high cardiac output would be represented on a thermodilution curve by
MUSC.
B, a small area under the curve.
yes, that is correct for 400. MUSC, you have next choice.
We'll go pharmacology 200, please.
Okay, pharmacology for 200. Which of the following is not classified as a diuretic?
MUSC.
B, valsartan.
That is indeed correct for 200. And MUSC, you still have control?
We'll finish pharmacology 100, please.
Okay, finishing out pharmacology. Which of the following has the greatest osmotic effect in plasma?
Quinnipiac.
D, albumin.
Well done, that is good for 100 points.
Quick score update. MUSC 1200. Rush 400. LTU 1400. And Quinnipiac 400.
Thank you, Zach. And Quinnipiac, you have next choice.
My heart will go on for 400.
Absolutely, anatomy and physiology for 400. Metabolic acidosis is characterized by
MUSC.
We'll go with, it's B, a rise in the plasma of HCO3 concentrated in low pH.
I'm sorry, that is incorrect.
Rush.
A, a fall in plasma bicarb concentration and a low pH.
Yes, well done, that is good for 400. And the board goes to you, Rush.
Let's do A and P for 300.
Okay, anatomy and physiology for 300. This law states that the resistance of blood flow in a vessel is directly proportional to blood viscosity and length of the vessel, but is inversely proportional to the fourth power of the vessel radius.
MUSC.
C, Passier's law, Pascal's law.
One of those. Yes, that is correct and good for 300 points.
We'll go perfusion monitoring 300, please.
Okay, monitoring for 300. If the air fluid interface of a pressure transducer is placed 3 inches below the in situ catheter tip at the phlebostatic axis, the pressure will read.
Quinnipiac.
B, 3 greater than the true pressure.
I'm sorry, that is incorrect.
MUSC.
A, 6 millimeters of mercury greater than true pressure.
Yes, that is indeed correct for 300. MUSC, it goes back to you.
We'll go monitoring again for 200.
Okay, monitoring for 200. What does the second heart sound S2 represent?
Quinnipiac.
The B, the closure of the mitral and tricuspid.
That is incorrect.
MUSC.
D, closure of the aortic and pulmonary valves.
Yes, that is correct and good for 200. And it goes back to MUSC.
We'll go clinical management 200.
Okay, clinical management for 200. Your patient's blood type is A negative. What blood type or types can they receive?
MUSC.
D, 2 and 3.
Yes, well done. That is correct. And MUSC, you still have control.
We'll go A and P 200, please.
Okay, anatomy and physiology for 200. The anterolateral papillary muscle is perfused by which coronary arteries?
MUSC.
C, 1 and 4.
Yes, that is indeed correct. And MUSC, you still have control.
We'll finish up A and P 100.
Okay, finishing up anatomy and physiology. Which of the following is not a layer of the heart wall?
MUSC.
B, pericardium.
Yes, that is correct.
We'll do clinical management 100.
Okay, clinical management for 100 and finishing the category. According to the AMSEC standards and guidelines for anticoagulation, a patient-specific heparin loading dose can be determined by all of the following except
MUSC.
B, height.
yes, that is correct and good for 100.
We'll do clot it like it's hot 100.
Okay, finishing coagulation for 100. Which of the following is not a vitamin K dependent clotting factor?
Quinnipiac.
B, 5.
Well done, that is correct. Okay, and Quinnipiac, we will finish off the board with Perfusion for 100. A patient's ECG shows a heart rate of 132 beats per minute. P waves are present in all leads. This rhythm is called?
Quinnipiac.
D, sinus tachycardia.
Well done, that is correct. Okay, it is now officially time for Final Jeopardy. Zach, can we please have a score update?
Yep. Good, John? Yeah. MUSC, 2,200. Rush, 800. LTU, 1,400. Quinnipiac, 100.
Thank you. So for Final Jeopardy, we will be doing this in true Jeopardy fashion where we will be revealing the category for the question. This will not be multiple choice. It will be an open-ended answer. Teams will provide their wagers. They are able to wager anywhere between 0 and the amount of points that they currently have. From there, we will ask the question. They will be writing down their answers separately on their whiteboards, and then we will be revealing the answers and their wagers after. They will have 30 seconds to provide an answer. So our Final Jeopardy category today is historical figures in cardiothoracic surgery. Okay.
Sorry, Shelby, can we get a score check again? What was the scores?
Zach, can you please repeat the scores again?
Score update, just once again, MUSC, 2,200. Rush, 800. LTU, 1,400. Quinnipiac, 100.
Thank you.
Is yours? Are you ready?
Yeah, ready as will be.
Okay, MUSC. Thank you. Okay. For today's Final Jeopardy question, little did I know that we were going to be alluding to this a little bit earlier today, so hopefully it'll help you guys out. But for Final Jeopardy, we have this individual is credited with performing the first human-to-human heart transplant on December 3rd, 1967 in Cape Town, South Africa. You have 30 seconds. Good luck. We're looking for at least a last name.
Time is up.
Okay, time is up. John, who's currently in 4th? Okay, Quinnipiac. What did you come up with? Question mark. And the wager was 100. So that brings the score to, is that what? Okay, 0. Who was 3rd? Oh, I'm sorry, I'll go ahead and reveal the answer. So the correct answer is, so what we're looking for, Dr. Christian Barnard. So Christian Barnard was a South African cardiac surgeon who performed the world's first human-to-human heart transplant on December 3rd, 1967 at Groote Schuur Hospital, I apologize for my pronunciation, in Cape Town, South Africa. He transplanted the heart of an accident victim into the chest of 54-year-old Louis Washkansky, who unfortunately passed 18 days later of pneumonia. Little history lesson for you. Okay, who is next? Okay, what'd you come up with? And you came up with Dr. Barnard. I'm gonna accept that spelling. And what did they wager? 800. And that brings their score to 1,600. So currently we have Rush with 1,600, Quinnipiac 0. Okay. Who is next? LTU. Okay, next we have LTU. What did you come up with? A sad face. And the wager is 1,200.
Thanks, guys. Appreciate the news.
Okay, and what does that bring their score to? 200. Okay, so we have Quinnipiac at 0, LTU at 200, and Rush at 1,600, is that correct? Okay, and finally, Team MUSC, who did you come up with?
I wanted to put Dave Fitzgerald, but we came with Edward, so.
I'm sorry, that's incorrect. But what did MUSC wager? 601. Yep. So. It's 15:49. Guys, I can't see it. Huh? Yeah. Okay, so what's the score? What? 15.99. So that makes MUSC score 15.99. So our champions this year is Team Rush with 1,600. Congratulations. Okay, you guys. Oh, got some music. Okay, well, thank you guys all so much for coming and cheering on these guys. I want to thank all of our participants and present them with some participation certificates. But okay, I just want to take this time to recognize all of the participants again. So from Lawrence Tech, we have Thomas Deeb and Jonathan Wolf. From MUSC, we have Jordan Andrews and Ian Villavicencio. From Quinnipiac, we have Brielle Boteau and Nicole Elvenzio. And congratulations again to our 2024 Perfusion Bowl winners from Rush University. We have Sarah Kulesa and Carmen Matagulai. I would also like to invite Daniel Nguyen to the stage, who is the Student Involvement Committee Chair.
Hello, everyone. So I asked Shelby to bring me up here, but she didn't know why we were bringing her up here. I think we all can see how much work she put into the Perfusion Bowl, and we wanted to take this time to recognize how much work she put in. We all get to see the final result, but I don't think very many of us get to see the whole process of creating the Perfusion Bowl, getting the questions together, pulling the board together. Shelby has put in more than a full-time job's worth of work getting this all up and running. She's been running around during the conference trying to figure out logistics, and she thanked everyone else, but I think it's time for the rest of us to thank her as well. Shelby. So we made a little certificate to commemorate her time as Perfusion Bowl director and her time being on the student council. We really appreciate having her here, and We're so lucky to have Shelby.
Oh, thank you.
Just a couple announcements. We have a student session over in the pediatric room right after this. Oh, we also wanted to mention, we wanted to thank Shamrock for sponsoring the Perfusion Bowl, giving us these award coffees. So thank you to them. And yes, yeah, we'll see all the students over in the student session. Thank you.
Appreciate it. We let him down.